Um, well, thank you so much for joining me today, Dr. Mona. My name is Allison Jarrar, and I'm with the Tree of Life Educational Fund, and we're extremely proud to be supporting the life-saving and critical work of the Middle East Children's Alliance. And I'm thrilled to be here chatting with you today to learn more about your work and the situation in Gaza so that we can encourage our supporters to contribute to the work that you're doing. So please, can you please tell us who you are and what you do, and a little bit about the situation on the ground in Gaza right now in the context of the global pandemic of COVID-19.
Okay, first, thank you very much for supporting Middle East Children's Alliance in their work in Gaza. That's very highly appreciated, because with your support and the support of others who believe that what's happening in Gaza Strip in Palestine under occupation is just unjust, and who believe that there is a great humanitarian crisis in Gaza, with this support we can continue our work. So thank you, a big thank you from myself and from my team and from the volunteers and from the families who benefited from your practical support at this difficult time. So my name is Mona Farra, and I am a medical doctor. At the moment I am the Middle East Children's Alliance project director, but before that I have been doing many things on the ground in Gaza, including being the deputy chair of the Red Crescent Society. I am one of the founders of Al-Auda Hospital and Union of Health Work Committee, and I did many things on the ground. My main philosophy of work was to health promotion and helping people in their steadfastness by making their lives possible under the occupation. So this was the philosophy, the health promotion and helping people steadfastness. Because I'll start talking now about Gaza. Gaza is a very small piece of land, and it is 365 square kilometer in space, and it is populated by 2.2 million. Half of the population are under the age of 18, and before this pandemic, the situation was really difficult in Gaza. 2 years when the United Nations has announced that Gaza will be an unlivable place by the year 2020, but it happened before. So there's big humanitarian crisis in Gaza before the pandemic. So the pandemic came on top of a deteriorating humanitarian situation in Gaza. Just speak, make the audience imagine what's happening now in Gaza. Hospitals, no medicine in hospitals. Medicine is enough only for 30 days. We don't have respirators if the outbreak. Now at the moment we're still in the containing phase of the pandemic. But if there was a breakout of the virus, of the coronavirus, the situation will be real disastrous, because we have only 60 to 70, the maximum of respirators in our hospitals. We have 30 hospitals in Gaza with 22 hospitals with 1,900 beds, and that makes 1.2 bed for 1,000 population, which is very low health care. And on top of that, this beds are not fit, are not. It is under-equipped, under-resourced, and under-staffed as well. We don't have enough staff to take care of the patients, and we don't have electricity, and this again will affect the health in Gaza. People are in really poor situation. Like 35% of people of Gaza are really in object poverty. But on top of that, 80% of the population now have no food insecurity. Adding to these figures, 50,000 people has been added to the object poverty people, because they rely on daily income with high unemployment. So if they manage to feed themselves today, they will not be able to feed the next day. But now with the pandemic, nobody is working. So really 50,000 people have been added to the object poverty population. And here comes our role as Middle East Children's Alliance. Since the start of the pandemic, we had our plan how we were to intervene. So we started by providing families with hygienic kits and educational material to educate them how can they take care of themselves and the family, and the preventive measures, the hygienic things. Because imagine in families in Gaza with this very, very poor health conditions, with the presence of unsuitable water for drinking, and in many areas no water as well. How can you advise them how to wash hands the 20 seconds when there's no water? So we provided hygienic materials and, as I have said earlier, educational material. Our volunteers had to do it in while watching their safety. And in the beginning, we did not have any masks or any protective gears for the team who were working with the families. I just want to make you imagine when you don't have income or resources, or living under occupation and in hardship life, normal hardship life. So the responsibility of fighting the virus will be even much, much more worse than others. And this virus affected big countries, big well-established countries. It made them feel really vulnerable. So imagine if it is going to happen. Up to now, it did not happen. The high peak, we had not reached the high peak. So imagine the comparison. Big, large countries were helpless while facing this. So I hope that we will not reach the peak, but it is coming, because surrounding countries like Egypt, Israel, Jordan, there's another new wave of the virus, because this virus, we don't know the nature of the virus and how it works, what's the deep nature of it. So we are facing real challenges here in Gaza: the humanitarian crisis, the deteriorating health system, the poverty, and being restricted in this small piece of land. It can be a blessing, because we don't have airport, we don't have proper harbors, we don't have the freedom of movement. So this could be a blessing on one hand, but it could be disaster and chaos on the other hand. The power is off now. You can notice that, yes. I have net because I have added UPS system, but there's no power. And this is happening every day, during the day, few times during the day, and we have only 4 hours of electricity during the day. So I don't know if you want to ask other questions. Yeah, we started with hygienic kits. We started with hygienic kits. Then we distributed food parcels. Up till now, 4,000 food parcels from MECA and some partners as well. We distributed to the community in Gaza with enough for 2 weeks. We have distributed 3 or 4 times for the families to make sure that they get what they need. And as well, we provided hospitals and medical facilities with medicine, masks, medicine, hygienic, high gel. I don't know what you see. The gel that you, disinfectant gel, and we supported a few projects of health organizations to do health visits for areas where our elderly people are living and they cannot move, where patients with chronic diseases cannot reach the hospitals because of the lockdown, and we supported them to make sure that their mobile clinics are working and reaching the people. And I'm really proud of this work, because we managed to do many people who did not have their treatment except with this organization that MECA funded to continue this work. So this is what we are doing, and we continue as well because we are expecting big medical shipment through the Egyptian borders. It will take some time, but by the time it reaches, the need will be high. So, and every day we are following up what's going on. What I want to tell you, the bright side of life. The bright side of life is important to tell that people here of my country are survivors, and they have a great deal of steadfastness. With your support and all the solidarity groups and people who believe in peace and justice, as well as internal solidarity, social solidarity. From my experience in the last 2-3 months during the pandemic, I could see families with little amount of money. They are helping each other, and they are youth are helping to support families, to help us with the distribution process, because it is not very easy. It is difficult. We are distributing food parcels and hygienic kits from the north of Gaza Strip to the south. So that means Beit Hanun, Jabalia, Gaza, Nusayrat camps, Khan Yunis, Rafah. And we are only 3. It is me and my staff who I appreciate their work very much. But I'm trying to tell you, despite that, we do our duty toward our people and towards the humanity. But still, it is not easy to work in such circumstances. I have 100 volunteers of MECA, youth, men and women. Again, whenever I say I need your help, they are always there, despite that they came from very poor socioeconomic classes, but they are happy. This is bright side of life, I call it, that when people are helping each other despite the disaster.
Wow. Well, Dr. Mona, that is, that's a grim reality, but I'm very grateful for the work that you're doing, your staff is doing, and your volunteers on behalf of the Tree of Life community. We're just in awe of the work you're doing under the circumstances. And like you mentioned, the virus is hitting different countries in different ways, and some worse than others. Here in the United States, it's extremely bad. Since we've started talking, at least one ambulance has gone by, and they're going by several every hour in my neighborhood. But in Gaza, the situation is clearly different because of the Israeli siege. And so I'm just wondering, as a last question, if you could talk for a little bit about how the Israeli siege has compounded this crisis, the ongoing humanitarian crisis and the COVID-19 crisis, and how many cases are there of the virus right now in Gaza, and are there lockdown measures being imposed by the local government?
Yeah, the first part about the Israeli occupation. We are under occupation, so don't expect them to be helpful, and they have been unhelpful and uncooperative, especially letting in the medications and the personal protective gears for the hospital staff. So they have been unhelpful and cruel. They were compromising, negotiating with not negotiating, I mean compromising, offering that if you want us to let the medicine into Gaza, you must wait, I have some visitors. So you need to, they are compromising this with the release of the bodies of the Israeli. I'll just move to the other room, can I?
Sure.
Yes, I'm sorry, because it is Ramadan and
مش مشكلة.
the power is back at least. So, the Israeli occupation is occupation, and they have been very harsh and very mean in letting the medicine and the protective gears, personal protective gears into Gaza. And on top of that, they were very mean in letting the diagnostic kits into Gaza. So they, in the beginning, it was just 100 kits. Now, slowly, with the help of the WHO, they are letting this into Gaza. So they don't care about if it is pandemic or not pandemic, and I'm not surprised. All of the time, the drones are on top of our heads in Gaza, and they are shooting against the fishermen in the west of Gaza and the farmers in the east of Gaza. So this is normal routine practice despite of the pandemic. And the other question you asked about how the situation with the cases. So far we had 20 cases of that has been diagnosed but didn't show any symptoms. Had been diagnosed that they are carriers. And today the borders, Egyptian borders, were open, so we expect 1,200 people to enter Gaza in the coming 3 days. Before that, 4,000 passengers entered Gaza, and as I have said, the results were positive only for 20 altogether. And people are locked down or go in quarantine. So many schools has been changed into quarantine, and hospitals and the hotels as well for people who are crossing the borders. People, there's something very negative. People in Gaza are not watching the lockdown properly. Yeah, many of us stay in our homes, but you still see crowds in the markets, in the shops. So this is something very alarming, but the health workers like myself and other organizations will try to continue passing the message that we should be careful, we should contain it, because the situation will be disastrous if the breakout happened. It is expected that 30,000 people, 25 to 30,000 people of Gaza will lose their lives if there was serious breakout, and I hope that it will not happen.
Well, Dr. Mona, thank you so much for your time. Ramadan Kareem, and so much solidarity from the United States over to you and your co-workers and your family. We're with you all the way, and we're honored to support the work that you're doing, and we're grateful to be in partnership with you all.
Thank you very much for all of you in the Tree of Life and for your belief in us and in our work, and we promise that we'll continue with the pandemic, and under the occupation will continue until justice prevail in Palestine.
Wonderful. All right. Tisba ala khair. Bye, Dr. Mona.